Hi, my name is Maylinda Chou, and I'll be presenting my drug levofloxacin. What is levofloxacin? So levofloxacin is a drug that is used to treat several bacterial infections. The brand name is Levaquin, and the generic name is actually levofloxacin. And it was discovered in 1987 by Daiichi Pharmaceuticals in Japan. However, it wasn't FDA approved in the US until 1996, and I believe December. In the picture on the right is just an example of what the Levaquin tablets would look like and would come in the bottle. So here is the structure of levofloxacin, as I drew it on the right. The chemical formula is C18H20FN3O4, and I have put the IUPAC name on the bottom, and I won't try to say it because I probably won't say it right, but if anybody was curious, it is very long and very complicated, which we have not encountered a lot of those in class. So as you can see here, the functional groups of levofloxacin. What's familiar to us is this carboxylic acid in the green, and then in the purple we also have a ketone, and I have also found some tertiary amines that we have also familiarized ourselves with. What has not been familiar, at least I think, are the fluorobenzene, which is in the orange, and then there are about 3 heterocyclic compounds, which we did not go into depth about, and I did try to find the specific names for them, but it ended up being really hard because they weren't any of the general ones, but these are what I found. So I did find one chiral center, one chiral carbon, and I actually drew the structure in a different way because I believe that it was easier to see the chiral carbon this way. So in the gold, you will see the carbon here. It is attached to a nitrogen, and then a hydrogen, and then a CH3, and then on its fourth different group is a CH2. And other than that, I couldn't find any other chiral carbons. So how is it prescribed? Levofloxacin is prescribed as a neutral compound, not a salt, so it has a 0 charge. It is also prescribed as a 1 stereoisomer, which is the I isomer of ofloxacin, and ofloxacin is actually in the same drug class of levofloxacin, and ofloxacin is specifically a race mixture of its inactive and active isomers, so levofloxacin is composed of just the single active isomer. And it is also prescribed in 3 different forms. There is the coated pill, which I put a picture of in the beginning of my presentation, and it is also available as an injection and also oral solutions such as eye drops. So how it works in the body, and this I found really interesting because this is a lot of like microbiology, but many common infections in the body are caused by bacteria. And levofloxacin is actually an antibiotic that has the ability to stop the multiplication of bacteria by preventing reproduction and the repair of their genetic material. Specifically, if we're getting into more of the microbiology of it, it involves the inhibition of bacterial topoisomerase 4 and DNA gyrase, which are enzymes that are very important and are required for DNA replication, transcription, repair, and recombination. And I thought that this was really cool because our body has so many different enzymes that work like this for us, and then there are certain drugs that can stop that and can stop the such as the reproduction, repair of genetic material of bacteria. So specifically what levofloxacin treats using the oral tablet is pneumonia, sinus infections, worsening of chronic bronchitis, skin infections, urinary tract infections, pyelonephritis, which is a specific kind of kidney infection, and the side effects that levofloxacin can cause in certain people. There's nausea, headache, diarrhea, insomnia, constipation, dizziness. There are also some other more serious side effects, which are seizures, hallucinations, depression, irregular heart rhythm. Of course, there were so many other side effects as there are with many kinds of drugs, but these were the most apparent ones. And the FDA had actually given several serious warnings about more possibly dangerous effects, which are tendon rupture or inflammation, nerve damage, central nervous system effects. There's also a lot of just restricted use on this drug that they have found over the years. And actually, I had talked to my cousin who was a pharmacist about levofloxacin. She had informed me that they no longer, or they try not to give levofloxacin to kids anymore because the side effects are so great, and they sometimes it's more of a risk to them than and they could possibly find some other drug that doesn't have as many side effects. So along with this and the FDA, there's been a lot more restrictions put on levofloxacin. And now going off on from my last slide, I actually did find this article that was written by a parent whose son, Jonah, he's age 24, he had been prescribed levofloxacin for a bad sinus infection. After taking the antibiotics, Jonah experienced severe pain and anxiety for months. And at the clinic, which Jonah had been prescribed the antibiotic, the physician treating him was unaware of the warnings by the FDA about treating sinus infections with levofloxacin. Jonah described feelings of anxiety, trembling, hands and his fingertips going numb, and a fast heart rate. And even months after, Jonah was experiencing chronic pain from the medication, like so many others have, such as insomnia, panic attacks, and paranoia were also frequent. So the big point of this article was that a lot of doctors and a lot of physicians and around the country, world and such, they do ignore a lot of the FDA warnings, and it is very, very dangerous to do so because there have been so many other people that have complained of chronic pain and having so many other very serious side effects from taking these kind of antibiotics, specifically levofloxacin. So these are my references that I have used to prepare this slideshow. I have attached each slide as to which reference that I have used them in, and I had a lot of fun learning about this type of drug and also the mechanism, how it works, and also the structure of it, how it's prescribed and everything. So thank you for listening, and I hope you all have a great end of the semester.